Okay, good morning. As you can tell, I am not at my sister's house. I am not out on that Three Seasons room that I love to sit in. I am not in the house. I'm not in her yard. Oh, my finger's in the way. So I am in the hospital, and so wanted to, as I document this journey, keep documenting all that's happening. So a couple of weeks ago, let's see, last Monday, well, before that, I've had this finger. I've shown you all video, on my previous videos, I've shown you my nail beds. I've complained about my nail beds hurting and the discoloration and whatnot. One of my fingers, the middle finger on my right hand, has been particularly troublesome. And so 2 weeks ago, when I went for chemo, because of discoloration and pain and how it was looking, the physician's assistant at my oncologist office gave me a prescription for doxycycline, an antibiotic, because I'm allergic to penicillin. So I got this prescription for doxycycline, and she was like, that should clear up your finger, knock out any potential infection. That was on 2 Thursdays ago. On the following Monday, last Monday, a week ago today, I ended up going to urgent care because blood and pus. Sorry for being graphic, but I'm saving you by describing it and not showing you my finger. So blood and pus was coming out from under my nail. So I went to urgent care on last Monday, and they numbed my finger up, burned a hole in the top of my nail bed, and drained the blood and pus and put a Band-Aid on it. And so I've kept a Band-Aid on, but when I went last Thursday for my final chemo treatment, they looked at it and it was getting worse. So she said, okay, the doxycycline's not working. Let's put you on a different antibiotic. So they put me on Bactrim. And so I started taking Bactrim on Friday. That was Thursday. I got the prescription Friday. I started taking the Bactrim. And my nail continued to get worse. Yesterday, I took the Band-Aid off, and I described my finger as looking like I had stuck it in some radioactive waste. I have a picture of it, and I could put my finger in the video. I could give you the finger. I could put my middle finger for my right hand in this video and show it to you, but it is so grotesque and disgusting that I'm not going to. So just suffice it to say that even the doctors here at the hospital, so I've seen the ER doctor, all the nurses in ER, several hospitalists, the doctors that work in the hospital and do rounds on patients in the hospital. Everybody has looked at my finger and recoiled. And it's uncovered. It's not bandaged up. I wish it was. It's uncovered. And they did cultures and took a bunch of vials of blood in ER and determined that they are chasing Pseudomonas, which is what the urgent care doctor thought that it might be, something, an infection I'd never heard of, Pseudomonas and Staphylococcus. I think I'm pronouncing that right. So they have deemed me a complex patient. What the ER doctor said is, in a healthy patient, we give you some penicillin or doxycycline would have worked and it'll knock this out and no problem. But as a complex patient, as a cancer patient, the antibiotics are not working, and Pseudomonas is a bacterial infection that is resistant to a lot of standard treatments anyway, antibiotics anyway. So they gave me 2 different IVs of antibiotics. I don't know why I'm looking up there because they're not here. They were in the emergency room, in the ED when I was still there all night. I also got morphine for pain and Teradol for pain, which only knocked the edge off. It did not, didn't put me to sleep and did not make the pain go completely away. But it did keep it from being on 8, on a scale of 0 to 10, keep it from being an 8. And knocked the edge off. So I've been admitted. They said I'll be here for 48 to 72 hours. I will get more antibiotics via the IV. They won't access my port for risk of infection. So I have 2 IVs in my arm. And I'm waiting on the hand surgeon to come in. I'm having a consult with a hand surgeon to determine, because nobody has touched this finger. That's how bad it is. I'm in ER and in the hospital, and nobody will touch my finger. I don't blame them. I don't want to touch it. It's pretty bad. And my kids were wondering whether my finger was going to have to be amputated. That's how bad it is. That's how bad it looks. So the hand surgeon will determine what to do next in terms of cleaning this up, whether it's something that, he or she is I think it's a he, is going to do, or the nurses can do, or whether or not it has to be surgically drained and cleaned. And I've already been prepared for the strong possibility that it will need to be surgically drained and washed out and cleaned. So that, obviously means a trip to OR today or tomorrow. So that is what is happening. Again, they're chasing Pseudomonas, two bacterial infections, Pseudomonas, which is one that is serious anyway, but again, in a healthy patient I would not have been admitted to the hospital. And there are all kinds of, extra precautions the nurse said that they're taking, which I'm glad, because they recognize I am a complex patient. I hate the fact that I'm a complex patient, let's be clear. And how the heck did I, battle through 16 rounds of chemo treatment over 5 months and never made a single trip to urgent care or, to ER or anything, only to be taken down by nail beds and infections related to my nail beds and whatnot. So at any rate, that's what's happening. So this will be my home for the next few days, and once I know what the hand surgeon has to say and any other updates, I'll be sure to do another video. In the meantime, I'm chilling here and I'm okay. I'm not sick. I'm in pain. The medicine has knocked the edge off, so I'm not in the type of pain that I came in here with and was in ER last night. So I'm comfortable. I'm not sick. No, I'm uncomfortable, but not sick. And I'm grateful for that. And so I'll keep you posted. And in the meantime, I am going to just try to relax. Unfortunately, my blood pressure is sky high, and it hasn't been. It's been very well maintained, but it has come down some. They've been giving me medicine to bring it down. I guess it's the anxiety and possibly the infection. I don't know. The pain. I don't know. Listen, my numbers are all going haywire. So the oncologist, the nurse practitioner from the oncologist's office has been here this morning. She was here when I got to the room. The oncologist will round on me today. The hand surgeon will consult with me today. So I will know more later on. So either later today or tomorrow I'll do another video. Thanks guys for staying on this journey with me, and see you soon.